大家好. Hello everyone. Today we're going to continue our Chinese medicine dermatology talk. Today's topic is acne rosacea, or we call it rosacea. Now let's go to our slide. Some people said, "Oh, Dr. Cao, can you put like some of your background on the screen so we know your background?" So that's why I put a brief CV here. Try to just tell you my background. Now let's go to our talk. Let me have a look at the slide. Okay. We talk about some basic knowledge about rosacea first, and then we go to the Chinese medicine. Now, what causes rosacea? The exact cause of rosacea is unknown. Exposure to certain climates, radiation, including UV radiation, resulting in vessel wall abnormalities might play a role in the development of the rosacea. Previously, it was believed that the Helicobacter, which is the stomach ulcer bacteria, was involved in the development of acne rosacea. And later on, some studies show that it might caused by a mite called the Mordex folliculorum. But still, I would say the real cause is unknown. I put some photos about acne rosacea here for you to have a look. But these are all the very severe cases. The photos you can find from Google. Nowadays, there are so many photos, different photos. When you see this photo, you'll think, "Oh, I know. I've met someone the other day on the street. When I walk on the street, I saw some people like that." And yes, it is very common condition. But we didn't think it is a dermatology disease. We think, oh, it just someone's have a red nose or red face. Now we just talk a bit more about acne rosacea. How is acne rosacea treated? The first step in the treatment is to avoid any trigger that may exacerbate the condition. Common triggers are certain food, for example, liver, yogurt, cheese, spicy chili food, direct sunlight, extreme of weather, alcohol, hot drinks, stress, heavy physical exercise, and hot flushes when women have menopause. All of this should be avoided if you want to stop rosacea to further develop. Some particular skin region can exacerbate rosacea as well. We should avoid them, because one reason maybe they have alcohol or they have steroid. Steroid is helpful at the early stage, but later on you'll find actually it can exacerbate rosacea, make it worse. Any skin care that irritates skin, we should change it. We should avoid to use them. That's the first step in treatment. Use non-irritating sunscreen is important as well. There are some sunscreens has less chemical elements in it. It will be less irritating skin. So people can use this kind of sunscreen, such as titanium dioxide, or some sunscreen with zinc oxide. They are less irritating. Using skincare with anti-inflammatory ingredients is appropriate in the treatment of rosacea. There are some examples here, like aloe vera, arnica, calendula, chamomile, cucumber, provitamin B5, and so on. Mineral makeup. For women, we do makeup every day, so it's important in that the makeup is not irritating, not making rosacea worse. Because rosacea actually has more female patients than prevalence than the male. But you probably think, oh, I remember most of the red nose, red face are men. But from the prevalence ratio, they are more female than male. Maybe female wear makeup, or they address it earlier because females are more care about their appearance. The mineral makeups such as glow minerals that have some anti-inflammatory agent can help reduce rosacea. They don't tend to enter the skin. They won't exacerbate rosacea. Some makeups or skincare products have more powerful anti-inflammatory agent. We can use them as well. But a lot of them need a doctor's prescription. You can consult your family doctor or your dermatologist to get this kind of skincare. Topical steroid, again, is not useful in the long term, although they can decrease inflammation at the early stage. But for the long run, they tend to worsen the redness and the capillary formation. Now, let's go to the, before we go to the Chinese medicine, we talk about this one. Antiparasitic agent are also found helpful for some patients to reduce the redness and the papules of the rosacea. They are also purported to decrease the parasite, the Demodex folliculorum, that has been implicated as a cause of rosacea. Again, this is only for some patients. Oral antibiotics may also be used in treatment of rosacea for the purpose to reduce inflammation for the papules and pustules, rather than the background redness and the capillary changes. Laser treatment can be helpful for the redness and the capillaries change due to rosacea. So you can suggest to patient. Now, let's go to the Chinese medicine. In Chinese medicine, we call rosacea drinker's nose, 酒扎鼻 or 酒糟鼻. We think there are 3 different stages for rosacea. Here, I put 2 photos here. The first one is one of my patient's photo. And this man came to me. He's very careful about his appearance. He said he wants to reduce the redness around here and the nose and here. That's the common area rosacea develop, which is here, 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 nose and jaw area and under the mouth. I would say his stage is the first stage called the red macule stage. And then if it's not treated or the induced factors or the causes is not reduced, after a period of time, it will go to the papule and the pustule stage. I put a photo from website here to show what's the second stage look like. And if it's not treated well, if it's not cared, and then it will go to the third stage called the renal fema stage. It will be the photos I showed you at the beginning of my talk. Yep, this is the third stage. These are all the third stage photo. And the etiology and the pathology of Chinese medicine for rosacea is like this. One of the etiology explanation for rosacea is yang qi in the lung channel turn to heat and change to blood heat, went to the blood, and after a period of time show up in the nose area because lung opens into the nose. And another explanation is too much spicy or hot and pungent food cause stomach heat. And heat has a nature go upwards, and also the meridians, they connect to each other. So the stomach heat goes to the lung heat, goes up, and then lung opens at nose and the face. So, and then the nose, the face become red and show the lung heat problem. One above 2 conditions is not treated, and the person continuously take the wrong food, it causes too much heat. There will be a lot of papules and pustules and enlarged follicles, capillaries. It will cause blood stasis. It will go to the renal fema stage. So that's the etiology and the pathology explanation for the Chinese medicine. Now let's go to the patterns and their treatment. The first pattern we'll talk about is accumulation of heat in the lung and the stomach. This probably is the most commonly seen pattern. The patient has red nose and the cheek, dry mouth, dry stool, yellow urine. The tongue is red with thin and yellow coating. The pulse is very fast, or you'll say fast. The treatment principle is clear and drain heat. The prescription is piperacin. Again, we modify piperacin. The ingredients of piperacin you can find out from my acne session. I'm not going to type them all here again. The modification is for the dry mouth, we add 麦冬, 天花粉. For the dry stool, we add 大黄. For the yellow urine, we can add 木桶. The next type is congestion of blood heat. The patient has some papules and pustules, also complaining about dry stool, yellow urine, the tongue is red with yellow coating, the pulse is slippery and fast, or stringing fast. The treatment principle is cooled blood and clear the lung. We use 凉血清肺饮. It has cool blood ingredients. It also has clean the lung ingredients, herbs. 凉血 means cooled blood. 清肺 means clear the lung. Yin is the decoction, or you say beverage. 凉血 mainly used 生地黄. You can see here it used 30 grams. 生地黄 is often paired with 牡丹皮. It will achieve much stronger result. And then you can see 大黄, 桑白皮, 大青叶. These are all the lung cleaning, cooling herbs. 紫花地丁, 蒲公英. These are the herbs for 清热解毒, clean the heat, resolve the toxin herbs. And 赤芍 is the blood moving herb. It's a gentle blood moving herbs. Helps to dissolve these pustules. So this is the ingredients. The modification. When there's too much pus, we add 败酱草, 野菊花. One patient complaining about the dry stool, we can add 大黄. For the yellow urine, we add 木通. Now the third type is the blood stasis type. For this type, the patient appeared persistent dark red, purplish red erythema, which thicken with thickening of the skin, and the renal phema, dark tongue, dark red tongue, with or without purple macules. The pulse is wary and rough. As we learned in Chinese medicine, diagnose and dermatology diagnose, I told before, actually none of the patient will show very typical patterns. They always some symptoms not appear. Some pulse may not be as the textbook said, or as I mentioned here, but we diagnose following patient's individual condition, and then we modify the formula. For this kind of rosacea, we can tonify 通窍活血汤. 通窍 means open the orifice. 活血 means invigorate blood. Tang is the decoction. So you can see the ingredients moving the blood and block the blockage herbs. So these are 桃仁, 红花, 赤芍, 川芎. These four herbs are all for moving the blood. So you can see the blood moving herbs is quite strong in the formula. Attention again is another one moving the blood. 茜草 is cool for the cooling the blood. 当归 is nourish blood and moving the blood. 桑白皮, 枇杷叶 that's for the lung heat and stomach heat cooling. 丝瓜络 is to unblock the channels. 生麻 is for the purpose of bringing herbs upwards, and then 甘草 harmonize the whole formula. Modification here is for old and weak patient. We add tonifying herbs like 党参、太子参、黄芪. For weak spleen, we tonified spleen. We use 白术、陈皮、茯苓. For people who have difficulty to cook herbs, you can try 大黄蛰虫丸. This one is not allowed to be sold in Australia. So, but in your country or your area, if you can find 大黄蛰虫丸, you can try. For some people don't like bitter, a nasty taste of herb decoctions. You can try. Now, for external treatment, we use 颠倒散 for early stages. 颠倒散 include 硫磺 and 大黄 in the equal amount, mixed with tea, any kind of tea, and put on nose once or twice daily. You can put the ingredients in a jar and use a cotton buds, cotton wool to put on your nose twice a day. The color is not that good. I have to tell you, another thing is 硫磺 is not allowed to sell in some country, like Australia. They consider as a bit toxic. It's a mineral component. And next external treatment, we can use 四黄膏. This again is in my acne section. You can go there to find ingredients. It's mainly for pustules. You use 2-3 times daily. For acupuncture, it is also helpful. We use some local points, the points around the nose and face, and then we use some distal points such as large intestine 3, 合谷. Once every 2 days for 10 times as a course, and then have a bit of rest, and then continue. Again, this will increase patient's cost. You need to discuss with patient. Some patients are scared of needles, and face is very sensitive area. So, do acupuncture or not? It's according to depends on many different kind of conditions, and the pricking to blood to bleed again is also can be refused by some patients. But it's also choose the local points, and mainly local points. The frequency is every 3 days. You apply once, like twice a week, and then 7 sessions as a course. Now, lifestyle advice is very, very important, especially food advice, to avoid irritating food, like hot chili, hot curry, sometimes even very sour food can be irritating. You ask patients, they know what irritates them. Give up smoking, give up drinking. It's in Chinese medicine, we think it's heavily related to the drinking, but maybe the Western medicine don't think that's the situation. There's no connection, but Chinese medicine really think the alcohol can make it worse, and the drinking alcohol can be one of the cause for that as well. The next one is avoid secondary infection of the nose. So we do the cleaning or face washing frequently. There's no harm, at least. Keep the face clean. Wash face with warm water and dry before apply external medication. A lot of people use pharmacy or Western medicine skin medication for this. It's not contradict with Chinese medicine, but remember, wash your face first, make it clean, and then clean your hands, and then put on all this skin care products. Okay, now our rosacea talk is finished. I give you a case study here. That is what I gave it to my student before, after the talk. Have a little bit of exercise and think, and then go back to the knowledge. Try to make up your own formula. There's no one formula, standard formula to treat a patient. That's the character of Chinese medicine. It's very individualized. For rosacea, the same problem, but on different person, you can see the formula is slightly different. We modify formulas or make up our own formulas according to our diagnosis. We can cool the blood, we can clean the lung, all according to your correct diagnosis. So the diagnosis is very, very important. Correctly diagnosed patient is one of the most important steps to achieve the best treatment result. Okay, this is Dr. Hua Cao. I hope to see you at the next dermatology talk. Thank you. Thank you. See you next time.